Moving on to our next story, a Michigan nonprofit is using AI to make dental care more accessible for Medicaid and uninsured patients. My Community Dental Center in Michigan is using Overjet. It's award-winning tech, and it's changing how dentists detect oral diseases. Joining us is Dr. Terry Dolan from Overjet. Dr. Dolan, let's talk about this AI. First of all, what is it and how is it making a difference?
Hey, thank you. Good morning, Tana. Yeah, it's really a pleasure to talk to you about our Overjet software, which uses machine learning to help dentists and the dental team more accurately and consistently diagnose dental problems, and maybe even more importantly, how to communicate those findings effectively to their patients to help them better understand what dental problems are, common clinical findings, and what they can do to either prevent or do early intervention for those clinical findings on the x-rays.
Yeah, so let's dive into it. So you take an x-ray, I'm assuming you put it into the software. How does AI take that and turn it into everything that you just talked about?
Yeah, so we built machine learning and a user interface so that when an X-ray is taken, it runs through our machine learning pipeline, and it's trained. The models are trained to identify common clinical findings like dental decay, like gum disease, like bone loss around teeth, or other common pathologies. And then what it does is highlight those findings in color on the black and white x-rays so that it's really easy for the clinical team not to miss a finding, but also to communicate that using color, coloring in the dental decay, for example, and showing it to a patient so that they can easily understand what that finding is and why it's important.
I think this is so interesting. So I know that you were a former, actual practicing clinician at one point. How much of a game changer is this in the dental world?
Yeah, as you've mentioned, I've been a dentist for quite a few years. I've worked in the dental academic space and as well as clinical practice, and I think it's one of the most exciting things I've seen come to dentistry throughout my career, because accuracy, consistency, and diagnosis is important. Also, in a busy dental practice, sometimes we miss things, not intentionally, of course. Dentists are trying to do the best for their patients, but in a busy practice, you can understand how it's easy to miss a clinical finding. And then, maybe more importantly, patients don't always understand the importance of oral health or what they can do to help prevent or do early treatment for dental disease. So I'd say this is an incredibly exciting finding in dentistry, and it really helps both the clinicians as well as the patients.
Yeah, absolutely. Probably for the patients to understand their results. Sometimes you get into the dentist chair and you walk out of the dentist office and you're like, wait, what the heck did they just say to me? Or I'm sure vice versa, trying to communicate some of those different scientific things to the patient can be difficult as well. So I can see where this kind of bridges the gap. I'm curious because AI is it's such an interesting topic right now and seems to be starting to integrate into many parts of our lives. How did you guys think, hey, AI might be able to help us in dentistry? And then how did you guys come up with the platform itself? Take me back to the beginning.
Yeah, that's a great question. And I would say I have to give credit to our CEO, Dr. Warda Inam, who's an engineer, and she had a personal experience. She went to the dentist, got an unexpected diagnosis of dental decay. She hadn't received a diagnosis like that before. And she said, I don't know, maybe I should get a second opinion. Got that second opinion. It was different than the first diagnosis. And at the time, she was working as an engineer in the AI field. And she said, maybe there's a better way. Maybe technology can help dentists be more consistent and accurate in their diagnosis. And so she incubated this company, Overjet, at the Harvard Innovation Lab, got some startup funding, and started developing this technology. The first to the marketplace, it's really exciting. And this was, several years ago, and the company has grown and developed to now more than 30,000 clinicians are actually using this technology in their day-to-day practice.
And I would assume that this software will be rolled out to even more. Is that in the plans in the future?
Absolutely. So, sometimes I would say in my experience, this has been so quickly adopted compared to others. And I think because dentists and patients really see the value of it. Dentists want to provide the best care to their patients. They want to use the latest technology, and anything that helps them be more accurate, more consistent, more efficient in their dental office is really a game changer. And so I would say yes. We have had great early adoption of the technology, and I only expect more and more people over time to be using it as well, to the point where it'll become part of standard dental practice.
Yeah, it seems like that's the case for a lot of AI applications out there. You know, AI, like I said, has become ingrained in our lives in so many different ways, and some people may not just even realize it yet, but it's there. And so I want to ask you too about the Michigan nonprofit. How we kind of found this story is My Community Dental Centers, and as I alluded to the top, Overjet is helping them kind of base their patient care off of this. How does this technology improve access to quality dental care, especially for those folks who may be underinsured or are on Medicaid?
Well, I'd say I'm really proud of the work that my community dental centers provides to patients in Michigan. As a community health center, they provide care independent of ability to pay. So if somebody is on Medicaid or public assistance or reduced fees, their goal is to provide high quality care to each and every patient independent of their ability to pay. And by them adopting this technology, it just really demonstrates their commitment to quality patient care. And so using the technology, hopefully they can do early identification of dental problems, use prevention to the extent possible, but ensure that every patient receives an accurate and consistent diagnosis and really understands oral health and why it's important. Leads to improved acceptance of dental treatment and completion of care so that people can achieve good oral health and maintain their health throughout their lifetime. And I'd say the Community Dental Center has done a really amazing job in adopting Overjet in their day-to-day practice.
Yeah, it's pretty cool. I mean, technology really is just going by leaps and bounds, especially with the AI. You were mentioning how AI, specifically Overjet, can help even translate the most complicated data to a patient and how they can understand it. I'm curious if there is something that you're hearing from dentists that, they're learning more about dentistry using this platform. If so, what might that be, and what are they taking away from that?
Yeah, it's really the dentist's responsibility to do accurate diagnosis, but what this does is provide a dental assist. It's almost like when you're driving a car and you have lane assist, or you have the controls that help you drive appropriately. This is just like in the dental office. The technology really provides that assist, helps colorize and identify those clinical findings consistently, accurately. And I think they just find it very helpful in their day-to-day work to make sure that they're always providing the best care of their patients, but also in their explanation to patients about the importance of dental health and these clinical findings. So I think they're finding it very beneficial, also helping them in their planning, their efficiency, that they can provide high quality, efficient, consistent care day in and day out to each and every one of their patients.
Yeah, take me into the technology a little bit. AI, specifically Overjet, assisting dentists in detecting oral diseases earlier and more accurately. I'm curious, can you give us an example or how this exactly does that more accurately and helps the dentist kind of aid in patient care here?
So I know each of us knows that we're supposed to brush and floss every day. And sometimes our oral hygiene is not as good as it could or should be, right? And so you can get early signs of dental decay, which is really demineralization of that hard external surface of the tooth. And our technology can pick up not just large cavities, but these very small early dental cavities. And then the dentist and the dental team can go in and provide fluoride or other preventive interventions to ensure that they don't get larger, or to do what's called minimally invasive dentistry, where you're doing a very small filling so that it doesn't progress to a larger problem. And so it really helps with that preventive aspect of dentistry.
Interesting stuff. All right, we really appreciate your time, Dr. Dolan with Overjet. Thank you very much.
Thank you.